now transitioning into, this is great and all, but as a physical therapist, what's my role in this? Where's my scope start and end? So the APTA defines our scope as promoting health and wellness through movement, function, and participation. And since we know that sleep impacts all three, it's literally the body's recovery system. So this is our wheelhouse. So, if we're going to be the experts in recovery, then sleep is right in our lane. So we got to really think of it that way. Sleep quality is going to predict outcomes across nearly every domain we measure as well when we think of pain, fatigue, mood, performance, all these factors that we think about otherwise, sleep impacts these. When a patient isn't progressing as expected, sleep could be one of our missing variables that we're perhaps not considering seriously. Screening for sleep disturbances is considered within the scope of PT practice. We're not diagnosing, of course, but we're identifying red flags and referring appropriately, just like we would screen for depression, fall risk, cardiac symptoms. We can and most definitely should be screening for sleep. So patient education around sleep, hygiene, pacing, recovery, it's all super important behavior. This is super important behavior change lever that we can use over and over again to help impact someone's life in a positive manner as physical therapists. We're already educating on things like load management, exercise dosage, and really sleep is just another dosage variable to optimize for individuals. So if a screen's, again, is kind of suggesting sleep apnea, maybe or we're screening depression, or we're screening for chronic insomnia or anything else, that's our cue to build up the team. That's our cue to collaborate. Not to treat necessarily outside of our lane, but to connect patients with the sleep medicine professionals, the psychologists, if that's warranted, getting back with their primary care while reinforcing recovery strategies on our end along the way. So, again, according to the APTA's role of physical therapists in sleep health statement, addressing sleep falls well under our umbrella of promoting wellness, preventing disease, and optimizing performance across the lifespan. So, as PTs, we're not just treating the daytime body, we're influencing how it restores itself at night